Hi, good morning, Johnson. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 2nd of January 2024. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Johnson Felix.
And what is your candidate number?
My candidate number is 266342111.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
That's all right.
How do you practice self-care?
The job of a nurse is very challenging. Along with the emotional pressure, there may be some other issues, such as job timing, night shift, etc. So, we have to be fit and fine for this job to be available all the time. That's why I exercise and meditate daily. I also have some stress-busting hobbies, such as gardening and cooking. These all help me a lot.
How will you educate a patient and a family?
Every patient has their learning style. So, we have to understand their learning style and adapt accordingly. For example, some patients want to read the complete medical instructions and detailed information. On the other hand, some just want the necessary information. So, we have to figure out what each patient needs.
What do you think about effective patient and family education?
Effective patient education is needed to ensure recovery and awareness, and to satisfy the patients and their families. It is very important to include the family in the treatment process, because they are the main caretakers for the patient in the future. So, we must explain to them the process and tell them how they can help the patient.
Have you faced a situation where you were under a lot of pressure?
In my previous job, I worked as an ICU nurse. I have experienced a lot of pressure every day in that job. Sometimes, I had to cover more patients than usual in the absence of other staff nurses. To manage my increased workload, I decided to create a list and priority of care. By organizing and paying attention to detail, I was able to manage things successfully. I also practice yoga, so that I don't feel any stress.
How do you handle the questions asked by the patient's family and friends?
Whenever the friends and family of a patient ask questions to me, I try to answer them with empathy. As a nurse, I have to give them the best information that I can. I try to answer them kindly, imagining myself in their position. When I find that I cannot answer all of their questions, I try to set boundaries and reasonably prescribe them.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good morning, Mihiraa. I hope you're doing well today. I'm your son Nikki's nurse Johnson. I'm happy to let you know that we're considering Nikki's readiness for discharge, as his post-operative recovery has been quite satisfactory. The medical team is pleased with his progress, and it seems like continuing his recovery at home could be a positive move. Before we finalize anything, are there any specific worries or questions on your mind? Your input is incredibly valuable in ensuring Nikki's transition back home is as smooth as possible.
Good morning, Nurse Johnson. I appreciate your inquiry. Nikki seems to be doing okay. But he has been experiencing some discomfort, which is to be expected post-surgery. And I believe it might be in his best interest to remain hospitalized until he reaches a more comfortable state.
I understand your concern, Mihiraa. I want to reassure you that it's quite normal for patients to experience some discomfort after surgery. In Nikki's case, his current level of discomfort falls within the expected range, and it doesn't necessarily indicate a need for extended hospitalization. Our medical team has been closely monitoring his progress, and as of now, there haven't been any complications. It's actually standard procedure for patients to go through an adjustment period post-operatively. However, I want to make sure we address all your concerns. Are there specific aspects of Nikki's recovery or the post-operative care plan that you'd like more information about or have any questions about? Your peace of mind is important to us.
Yes, I'm genuinely concerned about the level of discomfort he's going through, and I feel uncertain about the best way to handle his needs once he's back home.
I completely understand your concerns, Mihiraa. I'd like to provide information about the common after effects of a tonsillectomy and the recommended pain relief measures. After tonsillectomy, it's typical for individuals to experience post-operative effects such as nausea or vomiting, temporary bad breath, and a sensation of something being stuck in the throat. These are normal responses to the surgical procedure and should gradually improve over time. In terms of pain relief, it's advisable to use over-the-counter painkillers, such as paracetamol. Following the recommended dosage, provided on the medication packaging, or as instructed by the doctor, is crucial to effectively manage post-operative pain while minimizing potential side effects. If you have any concerns or questions regarding these recommendations, please feel free to discuss them further.
Sure, I'll be vigilant about that. Now, regarding taking care of him at home, what should I keep in mind?
I completely understand your concern, Mihiraa. In terms of caring for Nikki at home, here are some suggestions. First and foremost, ensure he takes his medications as directed by the medical team to manage any discomfort. Encouraging hydration is crucial, so offering water and soothing ice pops can be beneficial. Additionally, advocating for a sufficient bed rest during the initial 3-4 days will aid in a smoother recovery. As for his diet, a soft diet is highly recommended during this period. It would be best to avoid foods that are acidic, spicy, or crunchy, as these may potentially irritate. Gentle and easily digestible meals will contribute to his comfort and support the healing process. If you have any questions, or if there's anything specific you'd like more guidance on, feel free to let me know.
Okay, I got it. And, is there any specific advice or particular details I should keep in mind? For instance, when can he safely return to school, and are there any other relevant considerations I should be aware of?
Certainly, Mihiraa. As Nikki transitions to recovery at home, it's advisable to ensure a few key measures. Firstly, encourage him to avoid contact with sick individuals to minimize the risk of infections. When it comes to returning to school, it's generally recommended, after resuming a normal diet, achieving regular sleep patterns, and no longer requiring pain medication. However, it's crucial to be vigilant for any severe symptoms that may require medical attention. If Nikki experiences increased pain, notable swelling, signs of dehydration, or difficulty breathing, seeking prompt medical help is imperative. I want to make sure all your concerns are addressed. Are there specific aspects of Nikki's recovery, or the home care plan, that you would like more information on, or have questions about?
Thank you, Nurse Johnson. I appreciate your guidance and support during this time. It helps to have a clear understanding of what to expect. If any concerns arise, I'll be sure to reach out for further assistance.
You're very welcome, Mihiraa. Take care, and I wish Nikki a smooth recovery at home.
Thank you. That's the end of your OET-speaking. All the best.
Thank you, Mihiraa.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.